trisomy of 21st chromosome instead of 2 when it becomes 3 due to the genetic aberration. That is the cause of the Down syndrome. Maybe that is the cause. 21 is the chromosome 21 and March is the 03, which is instead of 2 when we have the 3 chromosome. So that is why I think this is the day is dedicated for the Down syndrome. And you know that it involves the developmental and intellectual development of people who are affected with it. And we have a great speaker. Today, I would like to welcome Dr. Kumud Srivastav, very accomplished person and a soft skill trainer, has been involved with CBSE and so many science congresses. She's one of the leading authority in this subject. And Madam, welcome you. And we appreciate your presence in our in this interactive session, our initiative from CRC Davangere. And I would like to appreciate our contribution of officiating director of NIE PID, Sri B.V. Ramkumar sir, for his constant support. And our program coordinators has been putting a lot of efforts. Dr. Neeraj Mishra, lecturer of occupational therapy, he is one of the key person to start this series. I'd like to appreciate Dr. Neeraj for your efforts. Dr. Tamarai Selvan, lecturer of physiotherapy, he is contributing a lot. Dr. Gyanvel, one of the dynamic person we have at CRC with excellent team powers and with support of our patron, Sri B.V. Ramkumar sir. Madam, I would like to once again welcome you, and I am sure that we all are going to benefit out of your great expertise. Thank you, madam.
Thank you, sir. Thank you for the opportunity.
Yes.
Thank you so much, sir. Thank you so much for extending a warm welcome to all participants, and special thanks for your words of encouragement and motivation. These words make a big difference, and it motivates us to keep on doing our best. So now I would like to hand over the program to our fellow coordinator, Dr. Gyanvel K, who is also working as Assistant Professor Speech and Language Pathology at CRC Davangere to further conduct the program. Over to you, sir.
Yeah, thank you, Neeraj sir, and thank you, Dr. Umashankar Mohanty sir, our director, CRC Davangere, for allowing us to conduct this program. So, before moving on to our program, I would like to tell few instructions for our participants that in between the question and answer sessions that we are going to conduct here, I request all the participants not to share their screen options in between. That will distract her. And please check your audio devices and connections. And for better listening, please wear earphone or headphone. And mute your audio, videos, and microphones in between the sessions. You'll be allowed to post your questions or ask the questions after the end of the discussions or question and answer sessions that we'll be having. And you can always type your queries in the question and answer box in the chat box, and we'll be requesting Madam to answer these questions. At the end of the session, we'll be sending a feedback form through the chat box, and I request all the participants to fill this feedback form for getting their e-certificate. Okay. So before moving on to the session, I would like to introduce about our institute. This is a general thing where our institute name is Composite Regional Center for Skill Development, Rehabilitation, Empowerment of Persons with Disabilities. So we are mainly focusing on these 3 areas. And it's one of the 23 CRCs that is established by Department of Empowerment of Persons with Disabilities. And it has a composite functions like different therapeutic setups, starting from clinical psychology, then occupational therapy, physiotherapy, speech therapy, special education, vocational training, prosthetic and orthotic services, and a different setup. And it is established in the center part of Karnataka, that's in Davangere, and it caters needs of persons with disabilities in the state of Karnataka and in Goa. and we cater the needs of all 21 types of disabilities as per RPWD Act. And along with these services, we also implement Kiran Mental Health Helpline. That's 1800-599-0019. It's a 24/7 helpline for mental health rehabilitation. And this is almost there in 13 languages. And I would thank our ministry for establishing this during the COVID pandemic situation. And it's still continuing. And it is catering all rehabilitation or mental health related issues were addressed, and you will get the preliminary counseling and further guidance on mental health related issues, and people can make use of it. And moving on to the program, I would like to welcome our speaker, Dr. Kumud Srivastav, who is a psychologist, counselor, and soft skills trainer, facilitator, and member of different associations in all over India. So I welcome you, ma'am. Here is her CV, which is not limited to this, but this is one for us. So it's like she has been working as a counselor for many years, and she has been associated with so many institutions all over India, and attended so many conferences and presented papers, published journals, research journals, and also associated as a counselor for 4 different companies, and mainly focusing, also a founder of Wellness Center in Lucknow, and provides counseling for all psychological issues to the clients and the patients. I welcome you, ma'am, for being here with us for this interactive session. And over to you, madam, for just introducing yourself, and then we'll go on to the main part of this session. Okay, over to you, madam. We welcome you from CRC. Yeah.
Thank you so very much. Good afternoon, everyone. Respected Director, sir, Neeraj, sir.
Good afternoon, ma'am.
You all. I am very happy and feel fortunate that I am connected with Ravangiri as well as with a lots of people and with masses. You know, Down Syndrome Day is a day to mark the related awareness and knowledge, or rather, you can help the persons who are suffering with Down syndrome for this particular day. You know, these type of days remember you that there is something which is very important, and we have to work for them as we can. So I just want to share my screen also to
Yes,
discuss about something theoretical, and then I would like to discuss more practical aspects of which is my style of discussion. And I requested one of my known parent, a child is with my consultation. She's a grown-up girl. She is having the Down syndrome with so many good cognitive attributes also. So they may join after 3:30. It will be good if they share their experiences also. Let's see. So,
Yes, ma'am. You can share your screen, ma'am. Yes, ma'am.
Okay. Just a minute.
Okay.
Is it visible to everyone?
Yes, ma'am. It's visible.
Fine.
You can enlarge it.
Okay.
You can make it bigger.
Fine, sir. Is it okay, sir?
No, ma'am. It has not come. You can put to the full screen mode. There you can find the third option. No. It went to Zoom. The third icon you can click near to that enlargement, ma'am. The last icon. Full screen mode is there. full screen mode or slideshow, you can put it up, ma'am. For slideshow, you can put it up for setups, custom slideshow or something from the beginning.
Slideshow,
Yeah.
Fine.
We haven't. I request all others to mute their mics.
Sir, what is the issue? Is it clear?
Yeah. Slideshow. You have to.
No.
The third. Hello. Yeah.
Hello, sir. Ma'am, can you stop screen sharing? And when you start again, you take the option of share my entire screen. Then it will be visible.
Yeah.
Share screen. Select the option of entire screen.
But as I do the entire screen, then only I can see this particular screen.
Yeah.
No, you share the entire screen and then you open your PC. We'll be able to see it. Click on share entire screen.
Yes, sir. I selected the entire screen, but
Madam only can see the screen, I think, not our view.
Yes.
Yeah. That is the thing. Yeah.
And if
No,
I
you can
select
change the view. There will be a change view options. Then also it will be visible.
Change view.
Side by side view or something you can take, ma'am.
Okay, I got it.
Now you can full screen. No. Start the slideshow.
Is it okay, sir?
Not yet.
Not yet.
You will have to select the entire screen only, ma'am. Then only we'll be able to see it.
Share entire screen. Yes.
Entire screen is not visible, sir.
It will be, ma'am. You just share your screen once after selecting entire screen.
Okay.
Start screen sharing.
Sir, when I open this,
Yeah.
entire screen, but then only I can see you people.
It is. There is one option there, I think, ma'am. But it's okay, ma'am. You can present your views, whichever you can.
And when
We'll
I
not be
select
able to see. Yeah. We'll not able to see the what is written on the slide if it is in not in full screen mode. Maybe you can try to present your slide for little bit duration with whichever option you could try. Then we can not that. The next two. Full screen mode, it is here.
full screen mode from, is it okay?
Yeah, this is okay, ma'am. You can try it. Yeah.
Okay.
You can try it. Yeah.
Okay, fine.
Yes.
So we are here to discuss about Down syndrome, and it is very important to call these persons or to address these persons every time. Children with Down syndrome, child with Down syndrome, and people with Down syndrome. Rather, you can say Down syndrome children. This is not the right way. And now, from the theoretical part to the practical part, I will start sharing my views on this issue. Though that issue is very, very large and very deep, technical also. So as we know, Down syndrome is a genetic disorder caused by abnormal cell division, results in an extra full or partial copy of chromosomes 21. For maybe, I mean to say, in general, it is a chromosomes 23 into 2, but here 21. This extra genetic material causes The developmental changes and physical features of Down syndrome. Is Down syndrome a disability? This is the big question. The extra chromosomes affects the way the child's brain and body develop, leading to developmental delays, intellectual disability, and an increased risk of certain medical issues. Down syndrome is the most common genetic cause of intellectual disability, affecting approximately 1 in every 700 children. Sir, voice and screen is okay? Are you people able to see the second screen? Neeraj sir,
Yes,
my
yes,
voice
madam,
is
we are
clear?
able to. You
Yes,
can
yes,
proceed.
yes, ma'am. You are able
Yes, sir.
to
Okay.
see it.
This is the third screen, right?
Yeah, we can see it,
Okay.
ma'am. You can
Thank
continue.
you.
Yeah.
Down syndrome is a chromosomal condition that is associated with intellectual disability, characteristic facial appearance that many times you can guess the child, and weak muscle tone in infancy. All affected individuals experience cognitive delays, but the intellectual disability is usually mild to moderate. Down syndrome is named for the English physician John Langdon Down, who categorized the condition but did not have it. And for that, his name, we know it that Down syndrome. Syndrome means a group of symptoms. What type of symptoms you can find in these children? Each person with Down syndrome is an individual, remember it. And their intellectual and developmental problems may be mild, moderate, and severe. Some people are healthy, while others have significant health problems, such as serious heart defects. Down syndrome, the most common chromosome-related genetic condition, affects development of the brain as well as the body. In almost cases, down syndrome does not run in families. So it's not necessary that every time all the children are having this particular Down syndrome problem. Children and adults with Down syndrome have distinct facial features. As these have very many physical issues or facial features, so people can understand the child is having some Down syndrome issues. Though not all people with Down syndrome have the same features, some of more common features include flattened face, small head, short neck, watering tongue, upward standing eyelids, unusually shaped or small ears, poor muscle tone, broad, short hands with single keys in the palm, relatively and small hands and feet, excessive flexibility, tiny white spots on the colored part of the eye called brush field spots, and short height. These are the general facial or physical symptoms, but it is not necessary that every child of Down syndrome having the same type of features of the same intensity. Infants with Down syndrome may be average size, but typically they grow slowly and remain shorter than other children of the same age. That's why the children who go to the school in mainstream or in different social areas, other children distinguish them from them and some psychosocial issues arise. Yes, they have some intellectual disability problems also. They have mild to moderate cognitive impairment. Language is delayed, and both short and long term memory is affected. Sometimes you find that the child is having some STM problem, or sometimes you find that child has STM as well as LTM problems. People with Down syndrome have difficulty with brain functions. That means they have a slight problem of comprehension, including problems with learning, memory, and speech throughout life, as well as on the onset in later life. of increased cognitive problem associated with brain changes of Alzheimer's disease also. Causes, though it is not a very well-known cause for this is established, nobody can say this is the only cause that can be the reason of this problem. But human cells normally contain 23 pairs of chromosomes. One chromosome in each pair comes from your father and the other from your mother. Down syndrome results when abnormal cell division involving chromosomes 21 occurs. These cell divisions abnormalities result in extra partial or full chromosome 21. This extra genetic material is responsible for the characteristic features and developmental problem of Down syndrome. Any one of three genetic variations can cause Down syndrome. There are three types of Down syndrome status. Mosaic Down syndrome and translocation Down syndrome. About 95% of the time, Down syndrome is caused by trisomy 21. That's why the day of this World Down Syndrome Day is on 21st March. The person has 3 copies of chromosomes 21. 3 copies for this the day marked for the 3rd month of the year. Instead of the unusual 2 copies in all cells. This is caused by abnormal cell division during the development of the sperm cell or the egg cell. Mosaic Down syndrome, in this rare form of Down syndrome, a person has only some cells with an extra copy of chromosomes 21. This mosaic of normal and abnormal cells is caused by abnormal cell division after fertilization. Translocation Down syndrome can also occur when a portion of chromosome 21 becomes attached or translocated onto other chromosomes before or at conception. These children have the usual 2 copies of chromosomes 21, but they also have additional genetic material from chromosomes 21 attached to the other chromosomes. So these are the 3 major features, or you can say the causes of Down syndrome. Then come to the most of the time, Down syndrome is not inherited. It's very important to understand. It's caused by mistake in cell division during early development of the fetus. Translocation Down syndrome can be passed from parent to child. Can be, not every time. However, only about 3 to 4% of children with Down syndrome have translocation, and only some of them inherited it from one of their parents. When balanced translocations are inherited, the mother and father has some rearranged genetic material from chromosomes 21 or other chromosomes, but no extra genetic material. This means he or she has no signs or symptoms of Down syndrome, but can pass an unbalanced translocation on to children, causing Down syndrome in the children. It can be, it is not always. What type of complication we find with these children? People with Down syndrome can have a variety of complications, some of which are more prominent as they get older. Heart deficits. Yes, many of the, or you can say most of the children who have the problem of Down syndrome are born with some type of congenital heart defect. These heart problems can be life-threatening or may require surgery in early infancy also, but not every time. Gastrointestinal or GI defects, which is related to digestive system. GI abnormalities occur in some children with Down syndrome and may include abnormalities of their intestines, esophagus, trachea, and anus. The risk of developing digestive system problems such as GI blockage, heartburn, or celiac disease may be increased. And immune system, yes, they have a weak immune system because of abnormalities in their immune system. People with Down syndrome are at increased risk of developing autoimmune disorder, some forms of cancer, and infectious diseases such as pneumonia. Sleep apnea, because of soft tissues and skeletal changes that led to the obstruction of their airways, children and adults with Down syndrome are at greater risk of obstructive sleep apnea. Obesity. People with Down syndrome have a great tendency to be obese compared with the general population. I feel and I found it that for obesity, there is one more reason that we have a tendency as a parent. If my child is having some problem, we always pamper our child in every aspect. So sometimes this is also one of the cause of obesity. This is my personal experience. Sacral problem. Some people with Down syndrome may have misalignment of the top of two vertebrae in the neck. This condition puts them at the risk of serious injury to the spinal cord from a overreduction of the neck. Leukemia also found with these young children. Dementia. People with Down syndrome have a greatly increased risk of dementia after 50s or around 50. They can have the risk of developing Alzheimer's diseases. Other problems also which are associated with their health conditions including endocrine problem, dental problem, seizure, ear infection, and hearing and vision problem. For people with Down syndrome, it's important to getting routine medical checkup or care and treating issues when needed can help with maintaining a healthy lifestyle. So this is the picture of the person or children having the Down syndrome. And as psychologists, and as well as myself is concerned, and many of you also, we are not very much concerned with the cause or the reasons and the symptoms. We are very much concerned with the treatment, establishment, solution, or rehab. That is our job, and that is very, very important for these persons. We all know that early intervention for infants and children with Down syndrome can make a major difference in improving their quality of life. And yes, I have seen this important factor, and the improvement or the rehab condition or percentage, high increased or percentage in rehabilitation and learning skills in children if we go for early interventions. Because each child with Down syndrome is unique. Treatment will depend on individual needs. Also, different stages of life may require different services. Many times our parents, they do not know about this problem. They are very misguided, and because of their high anxiety, they go to many places with many people and they have lots of advices and confusion. And for that, the early intervention becomes the later intervention. So it is then also, if we find a child with later intervention, then also we have a very much scope for doing so many things with the child rehabilitation.
Madam?
So we, yes?
Yeah, can I have a few minutes, ma'am? Can we, this is an interactive session, so can we move towards asking questions and
yes, please. Yes, please. I thought once I have to present, then we will start.
Okay. No. It's mostly interactive sessions, presentations, because people will get bored of presentations mostly. So we have, we can ask more questions on the question and answer session. It will be of more collaboration and participation. Also, people can participate more easily.
Very nice.
Yeah.
I love to do
yeah,
that.
love to do that. Yes, ma'am. That's what we wanted also. from your experience and thing. We want to learn from your experience and your way of counseling things and things. So can we stop this slide sharing? Let it be there. We want to hear experience and how you
Yes,
have done it.
I want to interact with you people,
Yes,
or
ma'am.
if there is somebody is having the same problem, can ask a question on this
Yes, ma'am.
open
Yes, ma'am. People are there.
platform. That will be good for us also.
So first, I'll start with the few questions in my mind. Then we can allow people to participate and ask their views and questions. Madam, there are few myths and things are there. Like age of consumption is also an important factor in the incidence or increase in the Down syndrome. I request all the participants to mute their mic so that people can listen to us. So, is there anything more you want to give information about the age of consumption, ma'am? Suppose if it is which is the more predominant cause that people are having, and how this syndrome is more moving towards the incidence is increasing day by day because of the lifestyle changes and other things. Is there anything you want to speak about it?
Yes, you cannot say that this is the only established cause, but
Yes, ma'am.
there is a very big cause which is that late pregnancy.
Yeah.
After the age of 35 or sometimes after 40. So this is a very prominent cause
Okay.
of having children with Down syndrome.
Down syndrome. So is the Down syndrome is only caused by genetic, ma'am, or is there any other causes also involved? Because most of the children, it's because of gene changes that is happening in the 21st chromosome that is happened. The main incidence is only because of the 21 chromosome. It is parent from parents. It is always transferable to child, or is there any other reasons that the people may
Yeah,
get
this is
this
a
genetic
chromosome.
variations? Yes.
Yes, you know it better than me. Yes, it is.
Okay.
This is because this is a chromosomal condition.
Chromosomal condition. So it's always genetic and more incidences toward the genetic variation. And there are a few things also coming up that more stress in the parents during the pregnancy also leads
Exactly.
to the variations
Yes,
in the
exactly. The studies show that
Yes.
there is a clear link between the stress status of the mother or after the pregnancy or during that time.
So
I
what-
mean after
Yes.
the conception and
Conception.
during the pregnancy.
So what all things parents should know, or before the conception or during the conception period till the child's birth, what all the things they should take into consideration when they are dealing with to reduce their stress and to increase the chances of getting the child born with 21 or 46 chromosomes alone. So is there any other
But
steps that the parents should
this is every time important that you have a pregnancy or when you are planning for your family. It is always important to take care of your physical as well as your mental health. This cannot be said if the person is having or the mother is having some stress. So every time the child will born with Down syndrome or the child is having some problem or some ID is there, but there are more and more chances of having the child with a special need. After if you the mother especially have some anxiety from normal to abnormal status. And as well as physical health is important because this is the rebirth of our lady, and the lady is going to create a new generation. So it's a very important and feel is you are the source, you are the main person to carry on these things. So feel happy and take care of your physical and mental health is important, and do some hobby or creative engagements also to maintain your happy hormone, as well as a balanced diet is required.
Because both physical and mental health is equally important.
Every time.
Every time. Yeah. And it is more important during this after conception and during the child.
Definitely, the lady is the person who is not one individual only. She is carrying an individual with her. So she has to take care of all these things.
I have one more question, ma'am. All children with Down syndrome will have intellectual disability in them, or there is some variations or exceptions in the cases? Like
Yes, sir. Yes, sir. It is a very clear demarcation in the as well as intellectual disability is concerned. We have a lots of type of cognitive abilities. Usually, we have this type of machine which is working for so many cognitive abilities and attributes. So sometimes you found there is little, I mean, span is low, attention span is low, memory is low. The child can have a average intelligence than child with I was discussing about the child in the beginning, and I proudly say that she is going to appear in class 10 board exam this time. Today she is having her board practical. So it is not necessary that every time the child is having intellectual disability, they can have some mild disabilities which are related to the cognitive abilities.
so, this
But,
year's yeah.
fortunately, we have a full scope to develop some learning skills.
Okay. So this year's 2022 theme for World Down Syndrome Day is inclusion means.
Inclusion.
So because we have to include every child with Down syndrome in all aspects of our lifestyle and day activities and remove all discrimination. So what will be the role of psychologist in the management of children with Down syndrome? How important a psychologist will play a role?
Yes. Inclusion is very much important with all CWSN. But with these children with Down syndrome, we have put this. This is the theme of this year, inclusion. And as we psychologists, we try to see the brighter part of the personality. This is the way of working, especially my working. See the brighter part of the personality and enhance it. Make more and more bright the brighter part of the personality so that the other weak points of the personality or cognitive abilities or ID problems can be vanished or can be dimmed. So we, as psychologists are concerned to deal with this issue, is very important in two aspects. The very first is to work with the child's particular attributes, the child's own skills, the child's, but whatever the child is carrying from birth, or you can develop with your help or support or education or practices or OT. But the another part is to do counseling of parents. Because whenever we have some special child, parents' anxiety is always high and social taboo also is there. So it is very much important to counsel the parents also to make them calm and ease to work with their child. Then, with the help of the expert, maybe some pediatric, maybe some audiologist, maybe some speech therapist, or maybe with some psychologist, and along with parents, the child can rise up to any extent.
Yes. So for inclusion, we need a multidisciplinary setup,
Yes,
and
it's
everyone should
it's a
contribute.
teamwork inclusion. We can add some people which are related to the physical health as well as they have some cardiac problem, they have some immunity problem. So we have to include some pediatricians or all these experts as well as psychologists, occupational therapists, physiotherapists, or speech therapists also because they most of them have delayed speech or they are very low expressive in their thoughts. They create their own world. And as the child started growing in, especially in teen age or in puberty age, when they started thinking about their appearance also, they develop something like this, which we call withdrawal. They started withdrawing themselves from the society. So there comes our role. And as I said, I know a girl who is going to appear in 10th board exams. So almost 4 or 5 years back, I presented her in our auditorium having 300 approx people, and there she played synthesizer. So that type of program is very much required, because if they have some problem, or if they have some issues or some weaknesses or sometimes some disabilities also, so we have to brighten her bright skills or develop some skills.
Yes. We have few questions in our chat box also. So, is there any particular reason why these chromosomal changes happen at exactly the 21st chromosome, or is there anything?
This is a very typical type of mathematics, so we cannot think what can be the exact
reason behind it. Yes. Okay. One more question we have is like, at what age exactly early intervention should be started for a child with Down syndrome?
As you come to know that my child needs something specific, maybe Down syndrome or maybe something different.
Okay.
As early as you can come to know, please consult a particular expert, maybe your pediatrician or maybe your physician, so that that person can guide you about this. And don't try to do this Google pay. If you go to Google and to start reading, and don't try to do all this. No, still we have some that particular type of practices with hard food and all this. And don't try to do medication by your own self, something like this. So as you come to know that God has given me some special powers to tackle my special child, so please go to the experts and listen to them and have patience. Have patience. Calm down yourself first, and then you can come to.
Yes, because the child with Down syndrome already have so many associated conditions. So we need to consult a team of professionals, and parents should be guided enough to check for a battery of tests to be conducted as early as possible to identify the associated conditions and start the treatment at early stage. Whenever the diagnosis is made at early stage, we have
as
to
early as possible.
Possible. Yes, ma'am. And one more question is like, can children with Down syndrome can be trained to be independent on their own? Is it possible?
Yes. Yes. You have to analyze their particular cognitive and motor skill abilities or attributes, and then develop them according to the capacity.
Okay.
This can be. I know a wonderful dancer also having Down syndrome.
Yeah. Because we have seen children like most of them are more socialized. Some children also have the shy nature things. It's like each child is unique, and they have their own characteristics and things, and we have to encourage and find their strengths and make them more independent in their own skills.
Yes, definitely. Definitely. We have to sort out this. And it can be done very easily.
Okay. So there is one more question, like any test or screening to underline problems related to Down syndrome? Do you have any screening test or test for underlying the problems with the Down syndrome? Is there any questions there?
No, I don't say there is a particular type of test. For physical health, the doctors have their parameters, they know. And what we do according to the developmental stages.
Okay.
That particular developmental stages, which are the parameter for this.
So is there any antenatal screening procedures to identify before birth only? Is there any the chromosomal abnormalities? Is there none before?
So studies are going on this matter, but there is no established
procedure. Yeah.
No established conclusion is there.
Yes.
Thank you for this.
Okay, ma'am. There is one more question. Like, they have commented on that. My class kid is a girl child and 15 years old. How to give guidance, and is there any possibility of them getting married? These doubts my class parents ask me, so I want your guidance in this aspect. That's what is the question posted here.
Okay.
Guidance on their
Yes.
marriage or possibility as
Yes, there is some cases they are married, not in India. I know I have a cousin they celebrated their 25th anniversary also. So there is scope for that also. But as far as 15-year childhood, this is the time to develop skills. You know, the very much important thing is for anybody is their self-esteem or confidence. So, and if the child is having whatever problem the child is having or whatever disability the child is having, if the child is self-dependent up to any extent, in any context, that helps to be a good developed self-esteem for that child, self-respect. So it's a very high time to develop that particular with this particular child, what type of skills the child can develop. Whatever, any motor skill and any vocational training.
vocational training.
Yes.
Also,
Then marriage we will see at the time of the marriage.
Okay. So do these children need special education training to be continued?
Yes.
And,
Yes, they need a special education in that context. That they have many psychosocial issues. The very first, the second is they have some motor disabilities also, and sometimes they have intellectual disabilities, like they have some mild disabilities as well as average intelligence and comprehension is missing many times, and delayed speech. Because of delayed speech, they develop some anxiety as they are not able to say their own thoughts, views, demands, so they develop some anxiety also, and their appearance is very much different, sometimes different. Sometimes people treat them as an ugly person also. So because of these psychosocial issues, because of these intellectual
Appearance.
disabilities, and because of weak physical health also, many times they need special education, and that helps them. But with the help of special educator sessions, with the help of their parents, and with the open mindedness of the society, they can run in ministry.
okay. Thank you for. And participants, if you have any questions, you can unmute and ask madam and clear your doubts regarding that. People are open to ask questions here and clarify your doubts, or if you want to have anything.
Even I
you
would
can
like to
discuss.
ask if somebody is having some experience with these children, they can share their experience also.
Yeah, Aarti Raina, she's, I think, Sujata, you can say. Aarti madam, yes ma'am. Yeah.
Hi, ma'am. This is Aarti
Hello.
Rana from Spastic Society of Karnataka. So this is my 24th year working with Down syndrome children. So what I have found, they are more like it is a joy to be with them. And as early as we intervene them, so it is going to help them. This year we are going to place 5 of Down syndromes in different areas. 2 we have developed their BPO skills, so they are going to get a job in their BPO. One is going to open his own business, like he's a partner of some Japanese hotel. He's going to run his own business. And one is our Art of Optimus. He's a natural artist and drummer. So what I want to say, that parents should never give up. Me
Yes.
as a special educator, I have learned so much from these. Are the real bundle of joy, but you have to be always with them, never leave them. Or sometimes in teenage they get some there are some socio emotional factors, but we have to be there with them. We have to make them understand, and definitely they are becoming more productive part of the society. So with
Exactly.
intervention like speech therapy, with physiotherapy and all, so they can do wonders. Thank you so much.
And you
Thank you, madam.
said a very important line which I would like to underline it. Never give up.
Thank
Never
you.
give up.
Thank you.
Thank you, Aarti.
Yes, I would also like to share with my class child, who she's really good. Downs, she is very, she just follows instructions and catches up all the concepts very fast, and she likes to dance, she likes to paint. Extremely good in their skills, actually. The only thing is we have to not give up, and then parent, we have to keep on giving boosts to the parents to encourage them, so that and find a correct place for them to keep moving on. I feel personally, I feel in those aspects the children can do very well. Down's children, kids, I'm telling you. Yeah, thank you so
Yes,
much, ma'am, for
exactly,
your
exactly.
yeah.
Every child has some unique spark. We have to find out that particular spark in that child.
Exactly. Exactly, ma'am. They have a lot of potential strength. We have to find it out, actually. As a
Definitely.
special educator, I'm trying my best to keep them, find out and place them in a proper place. So I'm supporting the parents also and advising them not to find out, to give them a better opportunity everywhere where they can perform well. Yeah. Thank you so much.
Thank you, ma'am. Thank you. If people have any questions, they can unmute and ask, madam. Anything if they want to discuss or say something here, they can. They are welcome here. They can unmute and speak.
Yes, go on, say.
Yeah.
From these type of programs, we can develop a team
Yes.
for any type of celebration.
Yeah, we can. Okay. I think there are no questions right now. So thank you, ma'am. Thank you for being with us and enlightening with your experience and knowledge. And we have to consider each and every child as an important person and have to strengthen their skills that they are present, and they can. And one thing you have said, there is a never give up, and we have to always try to encourage them and bring them as independent as possible and try to empower
Sir,
them. That is our
can I
main
put
goal. Yeah.
session, sir?
Yeah. You can say. Yeah, we'll. Srinivaslu, you want to have any question? Srinivaslu? Okay.
I would
So
like
if-
to say,
yeah.
I would like to take 2-3 minutes.
Yes, ma'am.
That there are some myths or misconceptions also. For that, I will say people with Down syndrome can develop work skills. Children with Down syndrome cry and sleep. Children with Down syndrome does not run in families. People with Down syndrome can drive also. People with Down syndrome can get married. All people with Down syndrome have sexual feelings and intimacy needs, and women have Down syndromes are fertile and they can give birth to child. So it's important to convey from your platform that they are having very common and very specific natural instincts.
Thank you for
And an
enlightening us.
interesting thing about Down syndrome person that they frequently become able to hold jobs, live independently, and enjoy other activities. But the average varies from individual to individual based upon their mental and physical behavior. And we have to create the environment and the platform for them.
Thank you, ma'am. Thank you for such a wonderful session, and I hope all the participants were enlightened and got the knowledge from your experience. I want every participants to spread this knowledge and create awareness more on children with Down syndrome and their abilities that they can do anything if they are given proper early intervention and training at their early age. So thank you, madam. Thank you for being with us. I thank especially the other two coordinators, Tamare Selvan and Dr. Neeraj Mishra, who are coordinating this prayer series. This is our 14th prayer series, and madam is giving her second lecture in this period, series. I thank for coming back to us, and whenever we are inviting in a short notice, you are there for us and giving us the support in conducting this program. I thank you, madam, for being here. Thank you.
Thank you
And
so
all-
very much,
Thank you, ma'am.
and all the best to everyone. And never give up. We have to remember that never give up for any aspect.
So for the participants, we have posted the feedback link. Please, I request everyone to submit their feedback in the link and you will receive the e-certificates. Thank you.
Thank you.
Thank you, ma'am. People have who have filled the feedback links can leave the meeting, and we meet at the next prayer.